Hello and good evening, everyone. So, as you all know, October is a month of festivities and celebrations. So, everyone is busy gearing up for Dhanteras, for Diwali. However, October is also an important month when we talk about breast cancer awareness. Now, many of you might be thinking, why breast cancer? What's the big deal about it? There is a big deal because the data, the stats are alarming. Breast cancer is the commonest malignancies among women globally. And if I talk about India, then from being fourth in the list of most common cancers during the early 1990s, it has now become the first. That's the urgency and that's the alarming data. And for same reason, today we are hosting a webinar on breast cancer awareness. And for that, we have here with us Dr. Ramya Velliveru. She is a consultant breast oncologist and endocrine specialist surgeon at KIMS Hospital, Kondapur and KIMS Hospital, Gachibowli. She has been trained at premier institutes of the country throughout her surgical career, and she practices evidence-based medicine. She specializes in the management of all benign as well as cancerous conditions of breast, both men and women, and endocrine glands, including thyroid, parathyroid, adrenal, as well as pancreas. She believes in the holistic management of her patients, and she has honed her clinical decision-making skills with extensive training. We are so glad to have you here, Dr. Ramya. Thank you for taking out time. As the data and the stats, they point out towards an alarming increase in the rate of breast cancers globally and more so in India. So the stage is all yours. Please take us through the process, what happens, what are the early signs and symptoms, and all other details that we should be aware of.
Thank you, Supreet, for that kind introduction. And I'm so glad that I have the opportunity to interact with you all. And I'll be very happy to answer any questions at the end of the talk. I'll try to keep it as simple as possible and as informative as possible. So let's begin with the presentation. So what is the concern? As Supreet was just now saying, we have been noticing there's this definite increase in number of women that are being diagnosed with breast cancer of late. And breast cancer is the most common cancer worldwide among women, constituting 23% of all cancers. And the same picture is true for urban India as well, and it constitutes the most common cancer diagnosed among women in urban India. And there's a lifetime risk of about 1 in 28. This is as per the Indian Council of Medical Research data, 1 in 28 to 29 lifetime risk for development of breast cancer among women in urban India. And the risk is about 1 in 55 to 60 in rural India. So every year, about 1.7 lakh new cases are being diagnosed. And it's important to be aware, like what are the signs, symptoms, what to do, how to diagnose these cancers early. So just a little bit about what is cancer. So the word cancer actually means crab. So crab, the body is made up of tissues, and tissues are in turn made up of cells. Cells have genetic material called as DNA, and if they enter into a growth cycle, at some phase of the cycle, the DNA can look like appearance of a crab, like we can see in the leftmost picture. So that's why it is called as a cancer, because the normal cells have controlled growth cycles. That means whenever there's a requirement for growth, they grow, and then once there's a requirement stops, it stops growing. It is completely under the control of the genetic information. Whereas a cancer cell, because of some changes or mutations in the genetic material, enters into an uncontrolled growth cycle. So they do not conform to the boundaries. They can cross the boundaries, spread to other parts. That is the most worrying part about cancer cells. So if the abnormal cells which have entered into uncontrolled growth cycles or proliferation occurs in the breast, then we call it like a breast cancer. So these changes are if happen in the glandular tissue of the breast, it is called as a breast cancer. So just a little bit briefly about global data. The incidence rates have definitely been increasing over the last few decades. The highest incidence is in European countries as well as in North America, Australia, New Zealand, and the least is seen in Asia and Sub-Saharan Africa. So the reasons implicated and have proven, some of them have been proven in scientific studies, the reasons being abnormal lifestyle patterns. Number one, because of increased fat intake, increase in number of women with obesity, especially in the postmenopausal phase, abnormal body weight, earlier age at menarche. Menarche means the age at which the girl starts having periods. So this has shifted forward earlier. The more and more young girls are starting to have their cycles, and the menopause is late. That means the cycles are stopping very late. And because of our lifestyle and because of change in the pattern of marriage, the age at marriage and the age at first pregnancy, they've all moved to the later part of the life cycle, and lactation has become less among women. So because of all this change in the reproductive patterns and fewer pregnancies and later age at first childbirth, there definitely is increase in the amount of estrogen exposure to the breast tissue. And like some studies have been done amongst migrated individuals. For example, if the studies done in migrants who have gone from other countries to the US, the initial risk is that of the nations that they've come from. But as and when the second and third generation migrants have been studied, the risk becomes similar to the risk which is at that particular nation where they're residing. So this just indirectly tells us that there are some environmental factors also, not only these reproductive patterns, there are some environmental factors also which need to be further evaluated. So I mean, compared to the just a little bit brief on United States, there are about 2.6 lakh new cases every year despite having such less population, and can cause is known to cause about 40,000 deaths every year. So though the incidence rates have decreased from through 1999 to 2007, still the numbers are still alarming. So coming to the Indian scenario, we have seen numbers, that is 1.7 lakh new cases per year as per 2018-19 data. And so the average age of women who are being diagnosed with breast cancer in India is about 10 years less. For example, in European countries, or for that matter in North America, the average age is about 55 years. So whereas in India, it is 10 years younger, the mean age, that is 45 years. And unfortunately, more proportions of women are being diagnosed with aggressive subtypes. So breast cancer is not a single disease. It is of couple of few types, at least 4 types. Amongst them, the aggressive subtype, that is called as a triple negative breast cancer, is seen in about 10 to 12% of the cancer patients in Western countries, whereas it constitutes about 30 to 35% of cancer patients in India. So the reasons for this difference are still under evaluation. And because of lack of awareness and because there's a lack of regular testing, more and more women are being diagnosed in advanced cases, higher stages of the disease. So as we can see from this bar diagram, about 50% of the women who are being diagnosed with breast cancer in India are less than 50 years age. So what are the risk factors for development of breast cancer? Number one, as we all know that more and more it is seen in women. For example, if we take 100 individuals with breast cancer, almost 98 to 99 of them are women, and 0.5 to 1% constitute men, but it can occur in men also. And with the risk of breast cancer increases with increasing age. So as we have just seen, the other factors that influence or increase the risk for breast cancer are early age at menarche, late age at menopause, late first childbirth, more than 30 years, postmenopausal obesity, lack of lactation, and alcohol and smoking, substance abuse is also known to increase the risk for breast cancer. And prolonged excessive use of hormone replacement therapy in postmenopausal women especially for more than 5 years has been seen to be associated with increased risk for breast cancer. So coming to genetic factors, we all now are hearing a lot about genetic testing in breast cancer and all this. So what is this all about? So there's something called as Angelina Jolie effect. It has been seen that after the actress has undergone testing, diagnosed to have a BRCA mutation, and she has chosen to undergo prophylactic surgeries as well as removal of her ovaries and breasts and then reconstruction. Because of increase in awareness, there has been more and more testing for these genetic mutations. But as such, to talk facts, genetic factors are responsible. That means familial disease or hereditary disease is seen in only 5 to 7% of the individuals with breast cancer. So what I'm trying to say here is, if we take 100 women who have breast cancer, less than 10% of them can actually have a hereditary disease. So it is not the most common pattern of disease that is seen. So as I had just mentioned, the most common mutations, genes that are undergoing changes that are responsible for breast cancer are BRCA1 and 2. They call as BRCA in layman terms, BRCA1 and 2. So other important thing one has to remember is family history of any other cancers like ovarian, tubal, peritoneal or pancreatic can also be associated with increased risk for development of breast cancer. So personal history of breast cancer, that means if a woman has a cancer on one side, she is likely to has increased risk for developing breast cancer in the opposite breast. So coming to what are the symptoms of breast cancer? The most common symptom is that of a painless breast lump. This is the most common symptom. And the other symptoms being color changes, any change in color of the breast, skin thickening or edematous skin that we call, like an orange peel. So or a recent onset nipple retraction. Some women may have inverted nipple from their birth or childhood. That is not the sign of breast cancer. But if there is a recent onset pulling in of the nipple, that could be a symptom of breast cancer or a sign of breast cancer. Or if there is any blood stained nipple discharge. Nipple discharge could be because of various factors, but if there is a blood stained nipple discharge, especially if it is from the single breast and of recent onset, it needs further evaluation. So a painless breast lump, many times women tell us, doctor, I had this lump for quite some weeks now, but it was not painful, it was not causing me any trouble, so I just ignored it. No, that is the lump that you should not ignore. Any lump in the breast should not be ignored and should be brought to the attention of a specialist. So a painless breast lump, changes in the skin or color of the breast, and pulling in of the nipple of recent onset, any blood stained nipple discharge, all these must be brought to the attention. Or some other signs can be a recent increase in general, the size of the breast, a sudden change in the size or shape of the breast, or swelling in the armpit. Not all swellings in the armpits are symptoms or signs of breast cancer. Deep inside the armpit, there are some glands called as lymph glands. If they deep inside the armpit, if someone notices a swelling, then that could also be a symptom or sign of breast cancer. And most importantly, in very early stages, we may not have any of these signs and symptoms. So, but we all know that if we diagnose any cancers early, the chances for cure are much more. So it's important that we understand how to identify these cancers very, very early, even before development of these symptoms. Because for a lump to be able to be felt by the hand, it has to be at least a centimeter size, depending on the location. If it is superficial, then of course smaller lumps may be felt. But if it is deep, even maybe a 1.5 centimeter size only can be felt. For cells are microscopic, they are not able to be felt by fingers. If it has to reach a 1.5 centimeter size, there has to be at least 100 million of those cells. So we should not wait until that time. We should be able to detect them even earlier. So if one notices any of these symptoms that I just mentioned, they have to report to a breast specialist. Talking about pain is in general not a symptom or sign of cancer, but there are some situations where breast cancer can be painful. So how is a breast cancer diagnosed? If a woman comes to us with any of these symptoms, how are we going to evaluate her? So we call what is called as a triple testing or triple assessment. Number one is we're going to in detail take clinical history of the patient, assess her risk factors, assess her body in general, what are her comorbidities and all these things, get an idea, and then perform a clinical examination of the breast. So we are going to visually inspect as well as palpate, that means feel the breast of the woman and examine her underarms as well, and also supraclavicular region of the woman, and then form an impression. This is the first test or first assessment. The second assessment is imaging. That means we are going to take some images of the breast and look for any cancerous or precancerous related changes. The most common imaging performed is called as a mammography. Mammo means breast, graphy means imaging. So it's like an X-ray of the breast. So I'll elaborate upon mammography in a little bit. So the second test that we perform is called as an imaging test, which is a mammography in general. The third test is a pathological assessment. That means if we are able to palpate and feel any lump, or if there is any change that can be biopsied, we take some pieces of the tissue for staining and looking at those cells of the tissue under microscope. That is called as a pathological assessment, which is also called as a biopsy, core biopsy. So what is a mammography? We all know what are x-rays. We must have heard about x-ray of the chest, which is the most common x-ray that is performed. Similarly, a certain type of x-ray imaging of the breast is called as a mammography. So if we perform on women who doesn't have any signs and symptoms of breast cancer, then it is called as a screening mammography. So if there are any signs and symptoms, if we are still evaluating the breast using imaging, it is called as a diagnostic mammography. So there are various types of mammography, but the latest ones are digital 2D or three-dimensional breast tomosynthesis. So in this, we are able to look at minute changes which are either pre-cancerous, pre-malignant or cancerous changes, and then evaluate the woman further. So sometimes we, especially in younger women, we may need to use ultrasonography for evaluation of the breast. And nowadays, routinely with all the screening mammography, we are advising ultrasound because certain changes are better visualized on ultrasonography. And MRI of the breast is also possible, and that is advised for young women, especially who have risk in terms of hereditary breast cancer or in certain situations as and when needed. So we do not have any regular screening programs in India for breast cancer. Number one, surely because of the population that we have, it is practically not possible to advise population-wide screening for women in India. But we follow what is called as an opportunistic screening. So any woman above 40 years who visits us for any complaint, we educate them about undergoing a screening mammography and then ask her to go through it regularly, and so that we can detect the changes early. Whereas if we compare to other countries like UK or USA, they have regular screening programs, and the most common method by which they detect breast cancer in those countries is through screening. Whereas in India, still it is because of the women feeling lump or these kind of changes that I just mentioned. So that has to change. So this is recommended for women who are more than 40 years. And this number is arrived at by looking at the mean age at presentation. This is from the Western data. We do not have any age recommendation or frequency recommendation for screening programs in India. But some studies are still being done, and we are expecting some results soon. So whenever we mention, about biopsy, women get scared. So what is a biopsy? Biopsy is like basically taking through a needle, we are taking some tissue bits from that lump and then hardening them, cutting them into pieces, staining them with certain stains, and looking at the cells under microscope to identify what kind of a pathology it is. Pathology means a disease. So this is important for the current standard. The gold standard for pathological assessment of any breast-related change is a biopsy. Earlier, we used to do something called as a fine needle aspiration cytology, which is FNAC. So that has now changed because in FNAC we may miss certain changes and it just gives us some cells, whereas in biopsy we are getting a bits of some tissues. So common myths about mammography and biopsy. So women ask us, is it painful? Is mammography painful? Because I've heard that they're going to squeeze the breast between two plates. So the answer is no. Actually, they're not going to really squeeze the breast. They just press lightly on the breast to get a 2D image. So most women who do not have any acute inflammatory or painful disease pathology are able to go through mammogram quite comfortably. So again, the second question that we get asked a lot is the radiation dose because of this regular screening mammograms, is it harmful? So the answer is the radiation risk from a mammogram is less than 0.02 rads, which is like if we are if we are just living in the environment that we are living for 200 days, we may get that much radiation. So the benefits for any test that we are going to do, if the benefits weigh much more out than the harms, so that test is recommended. So that way, a screening mammography is not at all a radiation risk for development of a cancer in the breast by itself. But the benefits can be huge if you're able to see any changes early. So another common question that women have about biopsy is, can a biopsy increase the spread of cancer? Biopsy is a standard method that is being performed for many tumors all over the body, and especially in the breast. Decades of experience and scientific literature has not shown any increased risk of spread just because of performing a biopsy. In fact, it guides us by giving information that we require in the treatment of breast cancer. So just quickly, what is the treatment of breast cancer? I'll just give you an outline. Like if suppose a woman is diagnosed with breast cancer with all these tests, then how are we going to treat it? The treatment is not like a one size fits all. It actually depends upon the stage of the disease and the subtype of breast cancer. So what do we mean by stage of disease? It is a term that we use to describe whether the tumor or the cancer has just limited in the area where it has started, or it has spread elsewhere, and if it has spread, to what extent it has spread. That so doctors, we use something called as a TNM, tumor node metastasis AJCC staging, but that's a very complicated staging. To put it in simple terms, we can call it as an early breast cancer, locally advanced or regional disease, and advanced disease. Early breast cancer is either limited to the breast or a very low volume disease in the armpit, or uh, the locally advanced disease means it has spread a little more to the regional lymph nodes. So lymph nodes are policemen of the body. They are located in multiple places. Especially if there's any disease like cancer, the cancer cells can travel through these lymphatic vessels and can get lodged in these lymph nodes. So evidence of disease in these lymph nodes, especially high volume disease, then we can call it as a locally advanced breast cancer. Or if the size is big in the breast, or if it has caused some changes within the skin or stuck to the chest wall in the breast, then also we call it as a locally advanced breast cancer. What is an advanced stage 4 or a metastatic breast cancer? Whenever the cancer has left these areas, the breast and the axillary lymph nodes, or has gone beyond to other parts of the body, like say bones or lungs or liver, then we call it as a metastatic advanced or stage 4 breast cancer. And then quickly telling about the types of breast cancer based on immunohistochemistry. So this slide looks very busy, but I'll just brief it for you. On the tissue that we have taken through biopsy, we are going to perform certain protein assessments for estrogen receptor, progesterone receptor, HER2 protein, and Ki67, and get the information on these four and try to classify the tumor into some subtypes. This information is required because we can understand or estimate the biology of the tumor. That means either this will be and how can we treat it. For example, if the tumor is hormone receptor positive, then we can use hormone therapy. If it is HER2 positive, we can use anti-HER2 therapy. If Ki67 is less, then we may say that this is relatively slow growing tumor. If the Ki67 is high, we can understand that it is a fast growing tumor. So how much to give, what treatments to give, that choice can be guided by this testing. So this is called as a immuno-histo-chemistry, and this is definitely performed on all the breast biopsy tissues to guide the further treatment. So gone are those days when the breast cancer was treated just by surgery. Now we have multi-modality treatment. In fact, a few decades earlier, the survival chances for a woman diagnosed with breast cancer was not so great. But nowadays, if the cancer is diagnosed in early stage and treated adequately and completely, then the 5-year survival is more than 95%, 95 to 98%. So depending on the tumor biology and the stage of disease. So the options for treatment are multimodality treatment. The options are surgery, chemotherapy, radiation, hormonal therapy, targeted or molecular therapy. So the decision for treatment is made in a multidisciplinary tumor board meeting, which is constituted by the breast surgeon who operate, medical oncologist who administer chemotherapy, a radiation oncologist, a radiologist who does the imaging, a pathologist who evaluates all this tumor tissue for pathological changes. And it is very important to understand that a woman who is undergoing treatment needs support from all around their family members, and a psychologist, a physiotherapist, a breast specialist nurse, and a cancer nutritionist. So it's basically a multimodality and a team management. So talking briefly about the surgery, various surgeries for breast cancer. We all know that the most common treatment that was done in the past was mastectomy, which is removal of the entire breast. But nowadays it's not required to be done in every woman. We have something called as a breast preserving or breast conservation surgery. All those women who undergo breast conservation surgery will also be subjected to radiation therapy, which is using of X-rays, and this is called as a breast conservation therapy. So this is the current standard of care for all such women who are eligible for breast conservation surgery. If we have done mammography and we have detected some precancerous or cancerous lesions, and since we can't feel them with hand, then how are those being removed? So we do something called as a wire localized breast conservation surgery. That means we pass a wire under imaging guidance, localize that lesion and go along the wire and remove that part. So that is called as a wire guided surgery. If we perform the surgery before without giving chemotherapy, or before giving chemotherapy, then we call it as a primary breast conservation surgery or primary surgery. Not all women need to undergo chemotherapy. The treatment, as I said earlier, depends upon the stage and the type of breast cancer. So if we perform surgery after giving chemotherapy, because either because the tumor biology is aggressive, or because the woman has a locally advanced disease, to downstage it, if we have given for that reason and then we perform surgery, then we call it as a post neoadjuvant surgery. And now we have something called as oncoplastic breast conservation surgery. So in the past, we used to have, the outcomes were not so great in terms of cosmesis. That means if a part of the breast is removed, then the leftover breast was not able to be cosmetically appealing. But now we have, with a better understanding of the anatomy, the blood supply, and development of advanced techniques called as oncoplastic breast conservation surgery, we are able to give good oncological cure along with good cosmetic outcome. Those techniques are called as oncoplastic breast conservation surgeries. This allows breast conservation surgery even women who come with larger tumors. It is safe and it is gives cosmetically acceptable results to the patients. Just briefly, 2 words about chemotherapy. What is chemotherapy? Basically, it is an intravenous drug or oral drug administration, which are cytotoxic drugs that kill the fast growing cancer cells. Because of that, they are like non-targeted. That means they act on all the fast growing cells. That's why they can have some adverse effects. But most of the adverse effects that occur due to chemotherapy are manageable with the current medications that are available. And if the benefits that the woman is going to get by taking chemotherapy are much more than the harm that it is going to cause, then only the decision for giving chemotherapy is taken. And sometimes it's important to improve the survival that the woman undergoes chemotherapy. So the most common concern that women have is, does chemotherapy cause loss of hair? The regimens that are used for breast cancer treatment, some of them can cause loss of hair, but it is only temporary. As and when the treatment gets completed, the woman is going to get her hair back. So there's no need to get stigmatized or worried about hair, because it's just a very transient or temporary process. So the radiation means using X-rays to kill the cancer cells. So especially this is done after breast conserving surgery, or for locally advanced disease, or for high-risk tumors. So then we've heard about all these risk factors that are causing increase in the chance of getting breast cancer. Then what can we do to decrease the risk for development of breast cancer? Obviously, we don't have control on when the girl is going to start her cycles and when the menopause is going to happen, but we do have control on when to plan the first childbirth, and then how to perform regular testing to detect the cancers early, and encouraging breastfeeding, lactating, and trying to plan pregnancy as early as possible, and especially avoiding postmenopausal obesity, having a balanced diet, exercise, avoiding substance abuse like alcohol and tobacco can come a long way. So, how can we detect breast cancer early? Number one, as I was talking about, is a screening mammography. That means regularly, either yearly once or once in 2 years, by undergoing a screening mammography, it is possible to detect breast cancer related changes or precancerous changes in the breast, and then get them treated early. So the other thing that every woman must do starting from the age 18, in fact, men also should do this, is a self breast examination. What is a self breast examination? This is a regular checking of her own breasts by either, there are two steps in this. One is looking at the breast, the other thing is feeling the breast for changes. This has to be done by every woman above the age 18 years, preferably 5th to 10th day after their first day of period, because the breasts tend to be a little sore, and they may feel a little lumpy when just before the cycles, during the menstrual cycles, just before the cycle. So the breasts are softest after the periods, which is 5 to 10 days are the ideal time. If a woman has irregular periods or is postmenopausal, then they can do it on a fixed day of every month. So a woman should undress herself, stand in front of the mirror, and look for any breast cancer related changes. Like I just was talking about, like if she's able to see any lumpiness, if the nipple is going in, or if there's any obvious discharge that she's noticing, a drop of a blood that she's noticing, or any skin changes, these kind of changes, if she notices, then she has to pay more attention. And then she has to feel her breasts, left breast with the right hand, right with the left, with the flat of her hand. In lying down position is preferable, with a slight thin pillow under her shoulder, and feeling carefully, systematically, each area of the breast, like with the flat of the hand, not pressing the breast with between her fingers. One should not press, then everything can feel like a lump. That should not be done. With the flat of the hand, rolling and looking for a lump or any changes that we just talked about in a systematic manner on the whole breast as well as on the underarms. Then it is possible to detect between these mammograms if there's any change that is happening. So to conclude, it is important to be aware of the breast health and what are the signs and symptoms of breast cancer. So be breast aware, and any changes that I have just mentioned, please bring to the attention. No need to panic. Teach self breast examination to one more individual at least, because it's important that everyone be aware of this. And early diagnosis equates to cure rates. So as of today, we don't have a solid preventive method. It's important to avoid or decrease the risk factors and try to get the diagnosis early, so to increase the cure chances and to prevent untoward deaths because of breast cancer. And remember, uh, after hearing a lot about breast cancer, do not come to the impression that all breast complaints are cancers. It is not so. In fact, 85 to 90% of the breast lumps are benign, that are non-cancerous. Not all the skin changes are cancers, not all the skin thickening, or so that's not the impression that we want to drive. But it is important to be aware, and then do not do self-treatment. Approach a breast specialist, get it properly evaluated, but there's no need to panic and be fearful, because right now we have excellent therapies, and the diagnosis of cancer is not equal to a death any longer. So be breast aware, and do bring to the attention of the doctor if you have any changes. So with that, I conclude my talk, but I'm very happy to answer any questions if you have.
Thank you so much, doctor. The session was really, really informative. I have a question. So, what should be the frequency of self breast examination? How oftenly should women do it or men do it?
So ideally, it has to be done once a month.
Okay.
So women who are still menstruating must do it 5th to 10th day after their first day of the period. That is because I was just mentioning, breast is hormonally very active tissue. Breast tissue, breast glands have receptors for estrogen and progesterone. And women go through menstrual cycles where the progesterone and estrogen levels are fluctuating in a cyclical manner, because the body is preparing for pregnancy and the breast enters into a certain growth cycle during the late half of the cycle, and then once the pregnancy doesn't happen, it reverses to normal. So because of these changes before the periods, the breasts can feel a little lumpy and sore, a little painful or heavy because of the hormonal effect. So to avoid unnecessary discomfort, it is preferable to perform 5th to 8th day after periods. If a woman's periods are irregular, or if the woman is postmenopausal, then they can do it on a fixed day of every month. So once in a month is, I think, good enough.
Okay. Thank you, doctor. Thank you so much. People can ask their questions. You can raise your hand and we can move you to the panel. Before that, I would like, if anybody wants to give a video feedback about the session, whether it helped you debunk some myths, please go ahead and give us your feedback.
I think we have few questions in the question and answer box.
Yeah.
So is every lump cancerous? After surgery, if PET detects no cancer cells in the whole body, do the patient still need to chemo? Is chemo or radiation give surely that the cancerous cell will not come? So first question is every lump cancerous? As I was just mentioning, not every lump is cancerous. As the lumps are subjected to triple testing, and if the triple testing proves it to be cancerous, then only it is cancerous. In fact, most lumps are not cancerous. But how do we know it? By performing triple test only. And after surgery, if PET detects no cancer cells in the body, the patient still needs to undergo chemo. So the answer for this is, like I just mentioned, the treatment just doesn't depend upon one particular information. PET scan can give us an idea about the stage of disease, and we also have the biology of the disease. So, for example, according to latest guidelines, if a woman has a triple negative breast cancer, even if the cancer is say 0 0.5 centimeters, that is 5 millimeters, or in some cases up to 1 centimeter, they still will need chemotherapy, because these kind of tumors, especially if they have higher Ki-67, they tend to come back in many women. So to combat that, we want to attack the cancer cells in every way possible, because if once it recurs elsewhere, then it becomes very difficult to kind of control the disease. So it's important that the cancer cells are attacked in all the ways possible. So is chemo radiation given surety that the cancer cells will not come? See, any treatment, there's no surety with anything, right? So in general, in science, we can do the best possible treatment and hope for the best outcomes. So if you really put the question that way, there is no surety. The data that we tell, like for example, when I just said that if for early breast cancer, if the treatment is given adequately and on time, the survival rate is 95%. How am I saying it? I'm saying this based on the scientific research evidence. So statistics are for statisticians, and we can only tell this just to get an idea. But in individual patient, what is going to happen, nobody can really give 100% surety. So that is true for all diseases, not just for breast cancer. So coming to the next question, that is also anonymous. Who are all the high category people? Is there any impact on hereditary? What are the reasons of breast cancer occurring in men? Because it is a non-functional organ for men. I think first question I've already gone through in my presentation. I've just talked about a lot of risk factors and what are hereditary and all that. So I'll go to the second question. What are the reasons for development of breast cancer in men? So breast tissue in men also has glands. They are rudimentary, especially in men who are obese. Some of the androgens, the fat tissue, obese means we are assuming there's a lot of fat tissue, adipose tissue, which has some enzymes called aromatases, which convert male hormones into female hormones. So in men who have liver diseases, or men who have genetic hereditary mutations like BRCA1, 2, or men who are obese, can have development of cancerous changes in these rudimentary glands. So men also have some amount of female hormones, women also have some amount of male hormones. Only if these proportions change, that is when the problem happens. So what are the reasons for coming back of breast cancer once it is identified and cured? So as I just said, cancer cells have the tendency to go from one place to the other. For example, a woman is diagnosed with breast cancer now and has undergone a PET scan. And in this PET scan, there is no evidence of disease spread elsewhere. And we have done the treatment according to the current evidence. But it is still possible that there are some cells which are, just a few in number and are not of adequate size. They have not formed into adequate size tumors elsewhere in the body as of today, but they're going to develop into cancer tumors sometime in the future. So that is the reason why in certain high risk women we advise chemotherapy to give medicines into the bloodstream so that they go to all parts of the body and try to kill these cancer cells. That could be one reason. That means the cells are rudimentary as of now, or have not gotten into adequate sized tumors that they're visible on the current imaging protocols. So the other possibility is that the cancer cells might be latent, are resistant to chemotherapy. Sometimes the cancer cells, because of the changes that they have, they become resistant. Like we must have heard about antibiotic resistance, like bacteria are resistant to antibiotics. Similarly, cancer cells can be resistant to chemotherapy. That is also another reason why they come back. So these are the few reasons why a cancer can come back. So that's why the cancer estimates are all in 5-year, 10-year survival numbers. So the cure rates are estimated at certain fixed intervals. So any impacts of food habits to occur in the breast cancer? Food habits like unhealthy lifestyles and consuming high fat diet and postmenopausal obesity can increase the risk for breast cancer. Can long-term breastfeeding reduce the chances of breast cancer? So the lactation is going to give breast tissue a break from unopposed estrogen exposure. But beyond 2 years or 3 years, just feeding continuously is not going to reduce the breast cancer risk. But not lactating, at least for a stipulated time, can increase the risk. I think that risk or advantage flattens out after a certain period of time, say 2 years or so. So we have another question. Why is breast cancer in men not as publicized as cancer in women? So I think I have just mentioned that the number one reason being the percentage of men with breast cancer is much less compared to men. For example, it's just 0.5 to 1% of breast cancer in most of the countries, except in some African countries like Tanzania, where they have 6% men being diagnosed with breast cancer. The reason, especially in African countries, the reason being they have endemic liver infections, which is going to increase because of various pathophysiological reasons, which is going to increase the amount of female hormones in their bodies. So that probably is the proposed reason why in some countries the percentage of breast cancers among women are higher compared to other women. So that is probably the reason that it's not publicized as much as it is for women. So what is your opinion on women feeding milk and in mid-time causes cancer? So I think the question is, suppose a woman has a breast cancer while she's lactating. I suppose the question is that. So first I'll begin by saying that there could be lumps that are probably felt during lactation. 99% of them are generally milk cysts, that means milk accumulations. They are not cancers. But if you ask me, can cancer occur in women who are lactating? Yes, it is possible. And but it is not so common. I would say it is rare. But any breast lump, as I was telling, if it is persisting or if it is not resolved with feeding, I mean, milk accumulation, obviously with feeding it is going to dissolve. All of us who have breastfed understand this. If it is persisting, then definitely it needs to undergo triple assessment with a breast specialist. So the other question that women ask is, if a woman has a breast cancer unknowingly and if she's feeding, then is it a risk for the baby? The answer is unlikely. No, answer is no, practically, because the child is going to, even if, like, say the cells are small enough that they cross and enter the milk, and then suppose they go through breast milk into the baby, is going to go to the baby's stomach. There in the acidic environment of the stomach, they all are going to get digested into bits and pieces, into the basic amino acids and say fatty acids. They're not going to remain like cells in the baby's body. So a woman should not be scared of this very rare phenomenon and then just have unnecessary fears. It is very rare for lactating women to lodge a breast cancer. But as I said, if someone is noticing a persistent lump, then they should just definitely get it evaluated. Then the next question is, I had a lump in my right breast which was extracted with surgery. Okay. What care should be taken during menopause time as to avoid the cancer or any hormonal harm? What kind of care or dietary care should be taken during menopause? So one thing is obviously avoiding obesity, having a healthy lifestyle, and regularly doing breast self-examination and undergoing screening mammography is the way to detect. For example, I mean, why I repeatedly say this is, a few years ago, or rather a decade ago, cervical cancer cervix was the most common cancer among women, especially in India. But now we know that it is caused by a human papilloma virus, HPV virus, and we have vaccines. And regularly women undergo pap smears, and if there is any change on pap smear, then they are undergoing treatment early. So because of all this understanding, information, knowledge, and treatment, cervical cancer numbers are slightly less. Whereas we don't have a one reason to, as of today, the scientific evidence is not clear what is the exact reason why the breast cancers are being formed. And we don't have any specific preventive method. So the only option becomes to try to detect it early. And if we have knowledge of these risk factors that we know of, then controlling them. So these are the only options as of today. So maintaining a healthy lifestyle, reducing the fat intake, avoiding postmenopausal obesity are some things which we can do. I had a lump in the breast which was extracted with surgery last year. What percentage chances it would reform? So depends upon, I think the answer for this question depends upon what kind of a lump it was. If it was just a fibroadenoma, it is unlikely to recur. If it's a cancer, then if it is adequately treated, then depends, the recurrence rate depends upon the stage and type of disease and what all treatments have been given. It's actually an individualized estimation. We cannot give a ballpark figure for this. What's the frequency for doing mammogram screening after the age of 40? See, as of Indian recommendations, we don't have any standard recommendations. If we follow the recommendations from the NHS, that is UK, it is recommended once in 2 years or 3 years, whereas in USA, it is recommended to do it once in a year because their risk is even higher. If it is 1 in 28 in India, it is 1 in 4, 1 in 8 in those countries. So I think by extrapolating that data for Indian women, I would say once in 2 years, or at least once in a year or 2 year, it will be a good bargain. So what is the treatment for non-cancerous lump? Depends on the size, depends on what symptoms, and for any lumps in the breast there are no medicines in general to speak. So if they are of a larger size, or if they're causing trouble to the women, then surgery is the only option, even for benign lumps. Sometimes there are very small lumps, like some women have multiple small cysts or fibroadenomas. They need not undergo any surgeries. So the treatment depends upon the individual case, actually. So women with uterus lumps, fibroids, may get the breast cancer. No, the answer is no. There is no association between having fibroids or endometriosis increasing the risk for breast cancer. If the cancer spreads to liver, as also along with breast, and after all chemotherapy done, what medication should be followed if there is 50% recovery only and still some tissues left in the liver? Is there any treatment? So the answer for this, we're talking about women who have advanced breast cancer, that is metastatic breast cancer. The treatment in these women, the intent of treating these women is palliation. That means the cure chance is unlikely, and we are actually palliating, helping the woman reduce her symptoms because of threat of the disease. So if chemotherapy is completed, then the further treatment depends upon, again, the biology of the disease and what targets are there to target. So again, it is individualized answer. We cannot in general answer this question like a general way. Good evening. Sometimes there will be rashes due to itching on the breast, particular seasons like winter. Is there any reason for this itchiness? So in general, in winter, the reason for itchiness is dry skin because of the temperature changes. So that can happen even on the breast. So if it is happening on both the breasts, and then it could likely be because of dry skin. But sometimes some itchiness and flaky skin, especially on the nipple areola, if it is persisting, if the dermatologist has ruled out dry skin, then it needs further evaluation. So I had a lump in my breast which was removed with surgery last year. What percentage of chances would it reform? Again, the answer can be given only after looking at all the reports, and what was the size, what was the biology, what was the pathology, and what is the extent of surgery. Are there any treatments without surgery when it is diagnosed at early stage, first stage? My mother had the same and she's diabetic and BP. How safe is it going for surgery? Early stage, first stage. So I think first stage breast cancer, the most important procedure and simple thing is to do a surgery. So the medical management comes into picture when the treatment is either advanced or aggressive subtype, or if it is not manageable with surgery. So early breast cancer surgery, in fact, surgery is sufficient if it is of the biology that I was like talking about. It's a favorable biology. So surgery is a must, and for some, as I was talking, if on mammography, if it is very small and not palpable to the hands, we can do wire guided excisions. I think, is it safe undergoing surgery? Breast surgeries in general are very safe, but if a woman 73 actually the age itself is not a contraindication for not undergoing surgery. Depends upon, as you have said, she's diabetic and hypertensive. With the current anesthesia techniques, with the current medications that are available, if the diseases are under full control, then it is safe to undergo surgery unless she has life threatening general comorbid conditions. But just having these diseases at the age of 73 are not contraindications or risk factors for not undergoing surgery. I think we have completed answering the questions. So if anyone wants to ask more, then I'm happy to answer.
Anybody wants to ask any question, they can raise hand and we can move them directly to the panel. There is a poll also on your screens. Please take out 2 minutes to give us your opinion about the session today. It will help us for future sessions as well. So doctor, I also have a question in the meantime. If
Sure, yeah.
somebody has passed the childbearing age and somebody does genomic testing and there it shows susceptibility of developing a breast cancer. So what is your opinion? Should somebody go for elective surgery, mastectomy? Is that a wise choice or no?
So depends upon what gene is mutated. Again, so genetic positive, having a gene which has susceptibility for breast cancer is a very incomplete information. So because there are a lot of genes that can have the risk for breast cancer. So the most common, I can talk about the most common genes, that is BRCA1 and 2. In them, if a woman has crossed childbearing age and then got to know about this, then there are two options. So either the woman can undergo prophylactic bilateral, that is to both the breasts. Prophylactic means before even the disease develops, may undergo removal of the breast tissue with immediate reconstruction. That means earlier we didn't have all these options. Now a woman even can undergo reconstruction of the breast using her own autologous flaps, her own tissues as a flap, or by using prosthesis. And if it is BRCA, then we also need to discuss about removal of the ovaries, because there is a chance for development of ovarian malignancies also. And the second option is to be under active surveillance. So then depending on the situation and what is the assessment of the doctor's assessment of the kind of visibility of the lesions in the breast, the density of the breast, they may need to be evaluated more frequently or by using an MRI. So these are the two options that we offer. So that the decision is a shared decision making. There's no single recommendation, but a woman is informed about all the risks, benefits, and choices, and it should be informed, shared decision making. And most importantly, I think we are just there's a trend in just regularly undergoing genetic testing in our country. It is not recommended. It is important that the family or the person has to go through genetic counseling before undergoing genetic testing, because we can have a lot of unwanted information. Sometimes we get the reports where suppose we do not have scientific data. For example, there's a RAD51 mutation. So there are no recommendations that one can help the patient with having information about certain mutations. So then it is unnecessarily putting the lady into some zone of fear where they know that they have some mutation, and then they get worried about how my girl baby should undergo next testing. So it's important that it's not like a routine health checkup where you go get your hemoglobin done. It is not like that. It's important that women go for genetic counseling, understand the pros and cons of undergoing the test, and then go for genetic testing. Like nowadays, we are seeing ads in airports to undergo genetic testing.
Yeah, it's a new
It should not be done in such settings. It can actually put the woman into a lot of unwanted, unnecessary stress. So we have a lot of genes on a regular basis. We undergo a lot of mutations. Our body recover also. We could have some genetic mutations from birth, which may not cause any disease in the future. But just having that information is just going to put into unnecessary stress. So it is important that they meet a genetic counselor, undergo that full counseling, understand, then only go through this genetic testing. Yeah.
So apart from mammography, one should go for BRCA1, BRCA2. Do you suggest that, or no,
No.
mammography is enough?
Screening mammography regularly done once in a year or two is more than sufficient to detect breast cancer early, and doing a regular breast self-examination. routine genetic testing, BRCA testing must be avoided. I was just telling that it is important to understand the implications. So, just it will cause unnecessary fear, unnecessary testing, and then your whole life, one may not develop a breast cancer, but they've suffered so much just by having this information. So, genetic testing is not recommended on a routine basis. There are some indications, recommendations where even women with breast cancer who are developing it before 45 years or have a certain triple negative variety or they have a family history, there are some women who are recommended to undergo genetic testing. Or if a woman chooses to undergo after having breast cancer is fine, but routine testing must be avoided actually.
So it should be left on a doctor's discretion.
Because yeah, of course, I mean genetic counseling and all these things, of course, one now by now must have understood after the talk that we have seen that only less than 10% of the women have hereditary breast cancer. 90% of them may develop it sporadic. So it can be the other way also. So woman has undergone genetic testing, doesn't have BRCA mutation. She cannot sit, calm saying that, okay, I may not develop a breast cancer. It is not like that. Sporadic cancers can also happen. So the logical thing is to do regular breast self-examinations and undergo routine screening mammographies.
Great, doctor. So we have a couple of questions. Can laser treatment be done on breasts to remove the nipple marks? Is that harmful?
Sorry?
Can laser treatment be done on breasts to remove the pimple marks? Is this harmful?
I am not sure if I understand the question correctly. I think, I can give my email ID. Maybe we can have prolonged discussion about this question.
Maybe this is from
Maybe.
a cosmetic point of view more than
Yeah,
from cancer.
I'm not sure. I don't think I can answer this question very well.
So, okay, doctor. So we have one more question. The skin at the tip of my nipples looks like granules from the top, but it is string-like under. It has had spots, blood, not much, just a dot or two. At times,
Is it a
because while
cracked nipple?
bathing, sorry,
I think they're talking about a cracked nipple because of
maybe.
dryness.
So you can,
So,
we can move you to the panel and you can ask your question.
yeah.
I think it is a cracked nipple because the person says while bathing, I seem to have scrubbed it harshly. Is this
Yeah, so it's a cracked nipple,
cracked
so
nipple?
it will heal like any other, skin abrasion. So maybe you should just moisturize it, keep it clean. That will be sufficient.
Okay. Is breast cancer in men the same as women, or does it come with differences?
So, because the breast tissue is not hanging as much as that happens in women, men tend to have early spread of the disease. That means it is more close to chest wall. It goes to lymph nodes a little more early, and so that's the difference. And it can ulcerate more. So, apart from that, the staging, the treatment options, the way it is undergoing evaluation is all similar compared to, I mean, that of the women. Incidence is less, and it can slightly in have a little advanced, not completely advanced, little higher stage at presentation.
Okay. Is the size difference between both the breast normal?
Yes, I think in 80 to 90% of the women, both the breasts are not symmetrical. In most women, right tends to be bigger, but even left can be bigger or smaller. They can have different positions of nipples, areola. So breasts come in all sizes and shapes. So discrepancy in sizes is normal. So what I was talking about in breast self-examination is if they notice any recent change in the size of the breast, that is when it has to be brought to the attention of the doctor. So for that, one has to understand how it looks on the baseline. So a woman should be breast aware. She should be aware how her breasts look and feel. Then only she is able to understand if there's any change. So that's what I mean to say. So having difference in size and shapes is normal, but if any recent change is that has to be paid attention.
Okay. Thank you so much, doctor.
Thank you so much.
I would like to conclude. If there is one single message that you would like to tell our viewers that are attending the session today, what would it be?
So early detection is cure, and be breast aware. This is what I have to say. So knowledge is empowering. Have this knowledge, but don't fear. Yeah.
Okay. Thank you so much, doctor.
Thank you for
This
giving me
was
the
a great
opportunity.
session. Yes, a lot of answers, a lot of people had a lot of queries and they were answered beautifully. Thank you so much for your time. And thank you to all those who attended today's session. Have a great day ahead and do take care, be aware and informed. Thank you so much.
Happy Diwali and thank you. Bye.